Hey everyone! Alright, this is our third time trying this live. Something, I don't know if it's going on my end, I'm guessing, because I'm echoing, but we're going to try again. And I'm going to be bringing on Christine in just a second. As I put in the title, she's a runner, physical therapist, and women's health specialist, super knowledgeable. We did a live with her. Yay, there she is, the other day, so I wanted to bring her back. Hi, Veronica! Thank you for being here. Let's see, I'm not echoing yet, so let's see if it happens once we add her headphones and see if this helps the situation. Hey Taylor, what's going on? How's Colorado? All right, I'm trying my headphones this time.
Hey everyone. For the technical difficulties in getting back on.
Yeah, sorry. Yeah, and thank you. Veronica got on all 3 times. She should get like a prize. I don't know what it is yet, but thanks for helping us out. I don't hear any echo. Ooh, this is weird. It sounds good so far. So, you sound good on your end? You hearing anything? Yeah. Okay. Awesome. Yay. It's going to work. Hey, Justin, thanks for hopping on. Hey, Caleb. All right. So, yay. Veronica says we're good. Yay. Okay, it works. All right. So, as I was saying a little bit, bringing Christine back on. She was happy to join us again. We brought her on a few weeks ago. Like I said in the title, she's a runner, physical therapist, and women's health specialist. And last time we were talking about leaking during running. So, if you haven't seen that interview, definitely go check it out. Super helpful. I already had at least one friend that reached out and found a PT in our area to get some help with. So that's super awesome. And today we're going to be talking about diastasis recti. I get a ton of questions about this all the time, especially from active moms who are looking to get back into things like, is this okay that I'm doing this? Is this okay? And so that's why I brought Christine on today, and we're going to be answering those questions. So thank you, Christine, for coming on again. So. Oh, actually, I can't hear you. Did you? Oh, I can. Nope, I can. I think it's just that if you say something short, it's that little. Yeah, you're good. I didn't hear it. So, anyways, okay. So we'll get started. Christine, did you want to, I know we introduced her a little bit last time. Is there anything else you wanted to say that I didn't say already to kind of introduce yourself? No. We're good.
We're good with that.
We're good. Yeah. Awesome. Mm-hmm. So, just to get started, I guess, if you could share a little bit, I mean, I'm sure everyone knows a little bit about what it is, but if you could share a little bit about what you see with your athletes or your moms that you see, and a little bit about what it is, what it isn't, and just a little bit to get started.
I think to kind of start off the conversation, I want to sort of define what is diastasis recti, and I feel like this term kind of is starting to get thrown around a lot, and there's more awareness around this particular diagnosis, I think, with social media and different things like that, and especially in kind of the fitness space. So diastasis recti specifically is the medical term for defining a separation of the rectus abdominis muscle. And that rectus abdominis muscle is what more people are commonly associating kind of the 6-pack abs. And we have a right half of our rectus abdominis and a left half of our rectus abdominis. And that muscle attaches at the kind of bottom few ribs, and it runs all the way down to our pelvis and attaches at that kind of pubic symphysis junction. So it's spanning a huge chunk of our abdominal wall. And it does a lot in terms of, obviously, core stabilization and supporting our trunk. But I think what's important to note is that the muscle itself is not actually, injured with the diagnosis of diastasis recti, which sometimes people are confused about. It's actually the connective tissue that's joining the right and the left half together. And that soft tissue is called our linea alba, and it's made up of fascia and the muscular tendon of the rectus abdominis muscle. And so it's joining the right and the left half together. So any type of separation, and I should say also quote unquote unnatural distance between the right and the left half of that rectus abdominis muscle is what is defined as a diastasis recti. And this particular injury can be above the belly button, it can be surrounding the belly button, and it can also be below the belly button, or it can be an entire, the entire length of the tissue. So it can kind of fall into a few different categories, and the term diastasis recti doesn't automatically delineate the location. It just says there is an unnatural width of that connective tissue. So in an assessment, you need to have someone that, you know, defines the location of it, the width of it, as well as the depth. And that's all done, you know, by someone who is trained in that assessment, like myself, being a women's health physical therapist. You can kind of do your own little mini test. We'll talk about that later on kind of in this talk, because I do get that question a lot too. Some people will reach out and go, I just don't know if I have one or not, or they want to make sure that, you know, they aren't ignoring it if there is something there. A lot of my my new postpartum moms, when they come in, that's like one of the first questions they ask me, being like, can you check me? I just want to make sure. I don't know if I have one or not. But
yeah,
people say that I should keep an eye out for that. So we can talk about that too.
awesome.
But the general definition of it, and in terms of, you know, what do we do about it, or things like that? That's, I think, what we'll kind of get into in this talk, because there's a lot of things around that.
Yeah. Yeah. So, I mean, I think that's usually the questions. It's like, you know, what can I do? What can I do? And I guess starting off with, I guess if you want to, I mean, and you can tell me if you want to go a different direction, but starting off with direction you lead your woman you're seeing in, you know, postpartum on the exercises they can and can't do, because I think that's the most common question I get, and kind of what you use to determine and what you tell them and what it depends on and everything.
So with a diastasis, I kind of go a couple of different ways. One, I want to educate people on what is it and what it's not, like we kind of just talked about. So it's that separation, right? And around your abdominal wall. So we can have a separation, but if we can educate that individual's body to utilize a more efficient movement strategy with the other abdominal muscles surrounding it, we can basically make up for that lack of that linea alba being intact. Okay. If we're able to generate that tension with the transverse abdominis activity, so kind of that the other layer of the deeper abdominal muscles that are underneath that rectus abdominis, and the fascial connection that is surrounding those muscles to generate that kind of drawing together of the muscles where the linea alba would normally be responsible for, then that's a case where that individual is safe and able to return to different activities and things like that, because their body's able to make up for that deficit. Okay.
Awesome.
When I have cases where an individual has a diastasis, but they aren't able to generate the appropriate tension with the other muscles and the fascial sling that's surrounding that area, that's when I start to give recommendations about, okay, we need to be thoughtful about certain activities, or we need to do activity modifications and things like that until our body's able to restore that connection. Now, sure, there are some cases where I have individuals that may not be able to do that for a variety of reasons. Sometimes it's just a mind body, they can't get it there. Sometimes they have other underlying issues too that are contributing to some of these challenges that do need surgical interventions. However, a large majority of people do really well with conservative treatment when they're able to get the right information and education, and then teach their body how to generate that tension with the muscles that are surrounding that linea alba in order to make up for it not being able to connect like it used to. But we have a secondary kind of team that we can deploy effectively to make up for that.
Awesome. Yeah, that's super helpful. I mean, that's like, I think of other injuries we can have, like even, not to go off topic, but, you know, ACL, like not all people have to have surgery, and you still can use the other tissues around there and get it really strong to still support it. But kind of similar, it seems, in a way different way, but that you can use, if you can get strong enough around it to support it, then you're good to go. Maybe not good to go, but yeah, but pretty good to go in the certain cases.
Yeah, there's a lot that can be done in terms of educating that transverse abdominis connection, and that's that horizontal abdominal muscle that's, you know, really giving us a lot of our stability, but that doesn't get the same, I think, recognition because it's not that beach muscle that everybody sees, like our rectus. But it's really doing a lot of work to stabilize our torso and to connect our rib cage to our pelvis. And that's really where we need to be doing a lot of our re-educating for individuals that have diastasis. And in some cases, if we're able to rehab and do this re-education early on in kind of the initial phase of a diastasis starting, the tissue can have an opportunity to actually come back together and heal itself.
Okay.
And that is possible. So a lot of my moms, for example, you know, that diastasis will do a significant amount of healing in that first kind of 3-month period postpartum, but it's continuing to heal up to a year after that. Okay, so we have a window of healing to bring that tissue back together during, you know, that first year postpartum if we're able to get the right information and the right guidance. After that point, the chances of the diastasis coming back together in terms of the tissue does drop off, but that doesn't mean that you can't still have an opportunity to re-educate the other muscles that are around that system, like I was talking about, to make up for that, that diastasis still being present. And this is where I think the information gets a little bit skewed, especially on social media, because I think that there's a lot of you know, people wanting a specific list of exercises that they are allowed or not allowed to do if they have a diastasis, or what activities am I allowed or not allowed to do. And it's not that black and white. Mm-hmm. I wish that there was a specific list that I could say, hey, this is what you're not allowed to do ever, or here are the other exercises that you're always going to be safe. It's really what, again, is your movement strategy. I can give you a list of what's quote unquote diastasis recti safe. However, if we're not deploying an effective strategy in terms of our core engagement, we can still be making that diastasis, you know, exacerbated or worse, even though we're doing quote unquote safe diastasis recti exercises. And so this is the other challenge too of, you know, I see a lot of fitness accounts, or I have my patients come in going, hey, I found this blog or these exercises, are these safe for me? And the answer is it depends. We need to go through each exercise and see what is your body's movement strategy. If we're doing core exercises and I'm seeing a lot of what we call doming, or kind of that bulge of the stomach outward rather than this kind of flattening and drawing towards midline with our transverse abdominis and things like that during a core exercise for someone who has a diastasis, then that's when I say, you know what? Can I give you other cues or things to help you be more aware to have that happen? If that isn't happening, then at that point, that's an exercise that I say, we're not ready for that yet. Mm-hmm. And so we need to have better communication for individuals that have situations like this that aren't sure. It's really beneficial to have a session or two with a pelvic floor physical therapist that understands this case better, to be able to give you specific recommendations for your body individually and to help you know whether or not your strategy right now is serving you or if it needs more support.
Yeah, no, that's awesome. So yeah, what I'm really hearing is, like, you know, obviously it's really beneficial to have someone, you know, a pelvic health physical therapist, ideally that's looking at you and can see everything, like you're saying. Like, I think this is honestly most things in medicine. It's not black or white. It's every patient dependent, which is how it should be. It shouldn't just be like, follow these exercises, take this pill, whatever. It should be individualized to you. So I think that's helpful to know. I mean, yes, it's not the easy fix. It's not just do this, don't do that, but it's really going to be the best thing for you, and figuring out where yours is at and which exercise you can, you know, for you, what ones you're doing well. So I think that's helpful. And do you see that it's, I mean, I don't really see it as common, but do you see that it's common that a lot of these people like knew to reach out to, you know, a physical therapist, or, you know, knew that was important to do, or how do you end up finding them, or they fell in your lap per se?
Usually it's not because they wanted to know whether or not the exercises were appropriate for them. Most of the time it's like, I'm still having a lot of back pain, I'm having a lot of hip pain, or other pelvic floor issues. And so that's usually what brings them into my office. And then I'm assessing for those things.
Okay,
Because the secondary symptoms that bring them into my office often link back to the primary issue, which is that core strategy. So when we have a diastasis, that's also affecting the quality of that intra-abdominal pressure system that we talked about kind of in the running talk that we did. But basically, just to quickly review for people, our torso and that abdominal cavity, we need a certain amount of healthy intra-abdominal pressure. And that's generated by our breath and by our core connection between our diaphragm, our pelvic floor, that transverse abdominis, that muscle that runs horizontally in front of our abdomen, and then our deep back muscles. So those four together work as a team to create this kind of muscular canister of pressure. And basically with that, we need to make sure that if we're not generating an effective amount of pressure there, then we don't have good trunk stability, and the brain and the nervous system go, okay, I need to use something else to generate that stability. So it will often overuse back muscles. It will overuse hip muscles. It will tighten the pelvic floor. It will use other structures surrounding it to make up for that deficit. So often a diastasis can, lead to other symptoms that are happening, and that's usually what brings somebody into my office. And then we kind of go, I walk them back through, and we kind of figure out a little bit more clearly, do we have a diastasis situation or whatnot? And I kind of educate them in the way that I just explained.
Yeah, that makes sense. Yeah, they start overusing other structures, and that ultimately what leads them to your office, but initially it was that. So awesome.
Yeah. Lucky too, where I live, I have a good relationship with the midwives in my area, and so a lot of them are more familiar with diastasis things too, and so they're kind of screening a bit with their clients. And if they see things like that, they will often refer their clients to me to get assessed and checked out for that. But that's not always a case for all practitioners. So it just sort of depends. But it's the secondary aches and pains that are keeping people from feeling comfortable / not allowing them to get back to their fitness activities like they want to, or at the volume that they want to. And then that's usually when they end up in my office.
Yeah, no, that makes sense. And do you know how common it is in general, the amount of people that end up having it? Or
still kind of, there's a hard and fast number of how many people end up with having a diastasis. And and I think part of it is we're still learning more about it. There's still a lot that the medical field is doing to kind of get a better understanding of why is the prevalence of this increasing and things like that. I will say too, since we're talking about kind of prevalence rates, and I want to kind of debunk a few myths around this.
That'd be awesome.
This is not just a pregnancy or postpartum issue. While it is very common due to pregnancy and the physiological changes that obviously have to happen to accommodate the baby's growth, it can happen to anybody that has a rectus abdominis muscle. So men can have this, women can have this, okay? So it's not a gender specific injury. It's something that can happen to anybody. And then the other thing is, like I said, we don't have to, for women, it can happen whether or not you've been pregnant and whether or not you've had a delivery of a baby. So also, just to throw that out there, I think that a lot of people think that it's only related to pregnancy, and that's not true.
Yeah, no, that's helpful. Helpful to share, so you don't feel like if something like that is going on, you're like, well, I can't have it. I was never pregnant. Or like I honestly can't remember who it was, but I was talking to a guy once that was like, yeah, I had that happen. And so, definitely not just related to gender or pregnancy, but awesome. Thank you for sharing. Let's see, did you have any specific questions? I know that your listeners had asked you that you wanted to answer that we haven't yet.
Sure. Question about someone who had a bit of a diastasis that was above their belly button.
Okay.
And they were talking about, they were asking what exercises are safe for me to do, or what things do I need to be considering. And this individual is currently pregnant in their first trimester. So something that's important to think about with any type of diastasis, like I said, and exercise, is really paying attention to what's happening at our core when we are doing a particular exercise. So if we're getting a lot of what we call doming, so if you contract your core and you see kind of that right and left half of our abdominals kind of starting to cone out, that is an indication that we're not getting a good abdominal contraction, and we're actually overusing that rectus muscle and not using the other muscles around it. So anytime we're not able to kind of draw those muscles together and create more of a flattening towards the spine of the connection, that's when we want to say, hey, can we adjust this exercise? Maybe we need to go down in weight or resistance if that's part of the exercise. And then is it just a loading issue? Or if we still decrease that and we're not able to eliminate the coning, then that's when I say, hey, that exercise isn't appropriate for you right now. So, and that's with a diastasis that's above the belly button. That's for any level of a diastasis. That's my benchmark when we're going over things or going through an exercise. I'm looking for, is coning happening? If it is, then that's an indication that we may or may not be appropriate for this exercise or this activity. So as you're moving through your exercises and things, being thoughtful of that, check in with that. Sometimes it's hard to tell, or sometimes it's hard to check. So if you need to have a second set of eyes or somebody to help you see whether or not that's happening, that's one way that you can assess it. Sometimes with my moms, what I'll have them do is, if they're able to, set up a phone on a tripod or a piece of furniture or something, have it record them while they're doing a movement, and then they can look back at the video and go, okay, what happened? Do I see any coning happening? Is this, am I able to connect my center the way that I want to? And that can be another way to sort of assess. Or I have them do that and then bring their video to me and I look at it.
Yeah.
So that can be another way. But those are the things you want to be looking for. Typically too, yes, the overarching kind of recommendation that I usually see commonly across the internet and things like that with any exercise recommendations for diastasis is avoiding kind of crunches and those types of things. I agree with that to a certain extent. However, and especially in those early phases when we're being diagnosed with a diastasis and we don't yet have a good connection of knowing how to use the other muscle structures and soft tissue around our torso to connect. But that doesn't mean that someone with a diastasis can never, ever do a crunch or ever move in that way. I have plenty of patients that I've worked with that we have educated them on how to properly perform that movement, and they can generate an appropriate amount of abdominal connection and not have their abdominals pull apart or cone while they go into a crunch. So it just takes the right amount of education and knowledge to re-educate that system and make sure that their movement strategy is serving them. And that's where, the gray area is in a lot of this, and why it's important and helpful to, if you have questions, to seek out a women's health physical therapist to help you with that.
Yeah. And I think that can really help to eliminate the fear, because I think there's a lot of fear. I mean, I'm sure I'd be fearful if I didn't know what was, what I could and couldn't do. And there's a ton of information out there on to help know that it's not a one size fits all, and no, you can never do this again. So I think that's helpful. Do you see a lot of fear in general with this population as far as when it comes to doing that crunch again? Are they like, are you sure?
It can be. I find that a lot of my patients come in with a lot of fear around it and feeling like it's almost this death sentence of a diagnosis, because they're like, oh my gosh, I have this diastasis and now I'm reading all this stuff on the internet. It says that I can't do, and it's like this huge long list, right?
Yeah.
Or
yeah.
I'm never going to be allowed to run again, or I'm never allowed to do my Pilates class again, or all these kinds of things. And that's where, I sometimes get a little bit irked when I see some of the stuff online, because I'm like, you guys are using all this fear mongering to, not give good information around the true, return to X activity or return to a certain exercise in general. Like we said, it's not black and white. So I like to kind of respond with, hey, there's a lot of hope here. it isn't this hard and fast rule of you're never going to be able to do X.
Yeah.
It's really a matter of working up to getting that movement strategy to work for them so that they can return to those activities. And I have plenty of my moms that have gone back to running, have gone back to their Pilates classes, have gone back to all kinds of things that they thought were on that never again list. Okay. And it really just goes back to knowing what is appropriate for your body versus that hard and fast black and white list.
Awesome. Awesome. And I guess while you're kind of talking about that and running and stuff, what have you seen with like the runners you've worked with? What does their progression tend to look like? Again, I'm sure it's different for everyone. But is there a certain progression they tend to follow until they're, you know, running again or whatnot?
An extent, yes, it's individualized depending on my patient, but you know, I'm looking at a lot of you know, we start with a lot of neutral spine abdominal work, so taking out the flexion or that kind of crunch position, training them there, also then challenging them with different leg lift type activities, single leg lift things, double leg lift things, and then as those, you know, movement patterns become more solidified, then we start to challenge the system from there with different rotation movements, different, you know, rounding and flexion movements and things like that. Because if you look in your day-to-day activities, we all need to do those things. You can't just go around your entire life staying in neutral, right? So we need to be able to have movement in all of those different directions for our day-to-day activities. And so again, education around that and helping them not be fearful of going into those positions, because there is concern around that. I find with a lot of my patients of, oh, well, I'm told that I can't do that, so how am I supposed to do this other thing, or pick up my groceries off the floor, or whatever. So again, I start with kind of that neutral, but then working them into all the other different directions. But that neutral zone is where we start in terms of the educating, and then we progress from there.
Awesome. And is their return to running kind of similar to any, you know, any woman that's postpartum really?
So anyone that I'm returning to running, period, we need to have a certain amount of, core stability. We need to have a certain amount of hip stability. So a lot of glute training, you know, and learning to load on a single leg stance type situation, and stuff like that. So, and then a gradual kind of run walk program is how I lead them back out into the running world. Yeah. So that we can, give the body a chance to learn that loading progression, but also that run walk program to give them space to assess how is my body responding. And how am I doing in terms of am I coning while I'm running? Am I not? So being able to kind of check in with that too is where kind of the run walk program I think is helpful, so that they can be assessing themselves when they're not with me in my office.
Yeah. Awesome. Let's see. So I had a question from someone. It's kind of similar to some that we've talked about really before, but she said, what exercises during pregnancy and postpartum can help prevent and or heal diastasis recti, and which should be avoided? So I thought like the interesting question, part of the question there was like, is there anything you can do during pregnancy to prevent it? And then the healing part, I think we've kind of talked on already, but is there anything necessarily people should be watching besides what we kind of talked about during pregnancy?
Similar to kind of looking for any type of coning is really kind of that's a good just benchmark for everyone to use. And so looking at that while we're doing any activities, you know, and then being mindful that, oh, if I know that this is always a consistent activity or movement that creates a coning thing, trying to avoid that for that pregnancy period. Yeah. And then moving out from that too, thinking about, you know, I also educate a lot of my moms that are coming in during pregnancy and wanting to avoid diastasis or being fearful of it, to say, you know, they're like, okay, so basically I should just not do any abdominal exercises is what I'm hearing. And I go, no, that's not true either. So we still have an opportunity to be working on core stability and core strength throughout pregnancy. It just doesn't need to always involve the crunches and the planks and all of the ways that we traditionally identify as core work.
Mm-hmm.
Breathing, proper breathing is core work. And we can do a lot of neutral kind of training in terms of our neutral spine training, in terms of that pelvis and our rib cage being connected on top of each other. And I have a lot of my patients do exercises to avoid being pulled into a rotation. So like kind of a Pavlov press is one that I really like a lot, where you have kind of a resistance band or something where you're sort of pressing out and you're having to resist your body wanting to turn or rotate depending on where you're anchoring that cable or the resistance band. And that's a really great place to do some core training that doesn't always look like core training to a lot of people.
Right, that's a good one.
And I love it. And it's a great one that I do with a lot of my ladies that are rehabbing from this or wanting to have some preventative exercises to incorporate into their workouts. And that's a really great one. Another one too that I like is, you know, anything that involves some good, like I said, breathing mechanics. If you are doing, you know, that really thoughtful big inhale out to kind of expand the rib cage and things, and then exhaling, drawing that pelvic floor up and in and having your abdominals wrap to center, you can feel the abdominals work in that way. And that's exactly the process that we're wanting to re-educate, especially if someone has a diastasis type situation. So during pregnancy and postpartum, that's one of my go-to exercises for my women all the time. I'm like, think about your breathing and incorporating that breathing when you're doing any type of movement or exercise or picking up that bag of groceries off the floor, things like that. That's all core work. And that's all really helpful core work to be re-educating that system as it's going through pregnancy and all those changes, as well as through that postpartum, the early postpartum period.
Awesome. Do you have any other questions that you wanted to address, or any other myths you wanted to debunk, or anything?
So I had one question about, or like I said, how do I know if I have a diastasis? Is a common one. So that curl up test I was talking about, the way that you can do a quick and dirty test on yourself. It's not as reliable as having a professional like myself who's trained in this to do, but I still want to talk about it because I think that that's something that can be helpful for people to say, hey, do I need to be thinking about this or worried about this? So if you lie on your back and you have your hands behind your head and your knees are bent, literally like you would set yourself up for a traditional crunch, okay? And then you want to take one hand and you want to place it along that linea alba. So find kind of the bottom of your rib cage. And then it's that entire line that's running right through my belly button and then down to my pubic bone, okay? So I'm going to take my fingers and you're just going to place them, you know, vertical to that line here. If you're doing this test on yourself, traditionally, if I'm doing it on someone, I have my hands perpendicular, but that's really hard to do on yourself. So I usually just go, you can go vertical and kind of just assess there. And then you're going to place your other hand behind your head and you're going to curl up like a crunch, and you're going to notice, do I feel kind of this pulling apart of my rectus muscles, okay? And then also, do my fingers sink down into kind of the softness of my abdominals, or do I feel kind of this hard stop, okay? If I curl up and I feel there's this gap, and I also feel that there is depth of my fingers being able to sink down into this like soft tissue, that's an indication that there's likely a diastasis there, okay? If I curl up and I can feel like, nope, there's sort of this hard kind of, you know, tenting of the muscle, I feel the tension there, almost like a little bit of like a trampoline, if you will, then that means that, hey, our tension is being generated, that linea alba is intact, I'm not getting a separation of my abdominals, we're good, okay? That's an indication that you likely do not have a diastasis. So I do that, you know, I run the length of that entire linea alba with my patients, and I have them do a few crunches basically in each of those positions to assess, A, do we have a diastasis, and where do we have a diastasis? So if you're or if you're not sure if you have one, or if you're wondering if you might have an issue with this, that's a quick and dirty test that you can do all the way down that linea alba to see. So again, if you notice if there is any sinking down or separation, I would recommend, it's super helpful to find a pelvic floor physical therapist to officially evaluate you and then be able to give you the right guidance as to what needs to be happening to help support your system better.
Awesome. That's helpful. I think we have a question. Do you work manually too on the posture and hips with your patients?
A lot. I do a lot of manual work. I do a lot of tactile work too, in terms of cueing somebody, playing with different positioning, having them go through a particular exercise. I always usually have my hands on people and helping bring awareness to different things. Yeah, I think that's super helpful, for sure. So I'm doing a variety of things to help with re-education. Yeah, good question.
Awesome. Yeah, and if anyone watching right now has any other questions, please post below. We'd love to answer them while we're on live. So,
wait, if there's any other questions. Another one that I had from someone was regarding, they said, you know, I'm a mom, I've had a couple of kids, and they're not sure if they have a diastasis, from my understanding, because they had also asked, how do I check? And then the other question that they had asked was, I noticed that I do a bunch of ab work, but I don't feel like my core is necessarily getting much stronger, / I also notice sometimes my core looks less toned after I do my abdominal work than it was before I was doing my core workout. So this is a really good question, and something that I notice that comes up a lot with my patients too. So if we do have a diastasis situation, and we're doing core work but not in the most effective way, or we're over recruiting that rectus muscle and we're getting some coning and some different things, then we are contributing more to the diastasis than helping it. Okay, so even though the intention is good in terms of wanting to have a stronger core, the execution of it needs to be thoughtful. And if we are noticing that we're not getting better connection of our core, or we're noticing that, oh, I'm getting more of like this bloating kind of look of my stomach or things like that after I do my core work, that's usually an indication that we have a diastasis, if that's a question mark. And then also the fact that the core work that we're doing is either too challenging for the system currently and the movement strategy needs to be assessed, or the movement strategy right now in general isn't connecting in a way that's efficient. So that also is an indication that seeing a pelvic floor physical therapist would be helpful to kind of dial in, is it an exercise issue? Does it need to be maybe regressed temporarily and then progressed back up? Or do I need to kind of basically revamp my motor plan and my movement strategies in general, because the foundation of my movement strategy might not be serving me in general. And so to get checked out too, because I have plenty of times when my moms have been doing months and months of core work and they're like, yeah, nothing's changing, nothing's getting better. And we go through it and they notice, oh my gosh, I'm coning with everything. I'm holding my breath with everything. I'm, totally using my back with this exercise and I'm not using my core. So there can be a bunch of different factors that are contributing. So that was a really insightful question that someone asked that I wanted to bring up to the group.
Yeah, that's super helpful. That's awesome. And Anjali just says, I work on the spine too. Majority of moms seem to have scoliosis that sets in with diastasis during pregnancy too. So
definitely get some differences in terms of the spine and spinal alignment, like she mentioned, and some of that can just be the muscular imbalances of where the body's trying to make up for that stability, and often using a QL muscle or some of our spinal extensor muscles that can then create this kind of curvature or appearance of a scoliosis in the spine. So great addition and comment.
Yeah, awesome. I think those were my questions I had. It was just basically the during pregnancy and postpartum prevent and which ones can heal, which I think we basically went over at the beginning. Um, and no cold, hard, exercises don't do, do. So, don't let those exercises and those blogs you see out there scare you for sure.
I mean, I know that black and white, yes and no, is always what we all want in most
Yeah.
cases of our lives. But again, this is one of those, it depends, and there's a lot of gray area in between. And the positive of that is that there's really a lot more hope than fear in this diagnosis. The body's super resilient. We have a lot of other structures around our midline and our torso that are very useful to keep us strong and stable and to help us be able to participate in all of the ways that most people want to get back to without needing a surgical intervention. That doesn't mean that if someone needs a surgical intervention that they failed or that, that makes, that case different. It just, that's what they needed for their body. There's lots of different contributing factors for some of my patients that need to undergo the surgery situation versus some of my patients that don't. But I think in general, there are way more cases than not that heal with conservative physical therapy treatments. Can benefit from, even if it's just a few sessions with someone just to get some good information.
Mm-hmm.
I think a lot of times people are maybe afraid to reach out to PT because they think, oh, I'm going to be in PT for, weeks and weeks to fix this. Sometimes that happens, but a lot of the time my patients within, 2 to 3 sessions of just really getting some education and knowing what to do, then are empowered to take that information and apply it in their day-to-day. And then maybe sometimes they check back in with me in a month or 2 months or whatever, just for kind of a tune-up and keep going. So it can be something that doesn't have to be weeks and weeks long. Just getting in to see someone for an appointment or two to gather some helpful information can be over so many ways.
Yeah. And I feel like what I've heard you talk about a lot throughout this is, as from a physical therapy standpoint, is looking at their movement strategies, how they're moving. And I feel like that's really only something you can get with someone else watching you, and someone to assess that. And it's not just doing the exercise, but it's how you do the exercise. That's even more important. And that's really with anything, but.
It is. It's not special just to this particular case. And yeah, it's something that I think for a lot of people, that movement strategy is what we can all improve on. And it's not for this diastasis situation, but also it's going to make you a better, athlete in general with whatever activity you're doing by getting a movement screen and check. I kind of wish that physical therapy for most people had kind of like that annual checkup, like we're supposed to do with our primary care docs. Like, go do your annual check-in with your physical therapist to be like, hey, how am I moving and could I move better? Usually the answer is yes. And getting some guidance around that because, we all have one body, and the more that we can kind of just be aware of it and learn about it and understand how things work, the more empowered we all are to, move better and feel better and know how to load our bodies better. And so that only helps us be more successful in whatever activities we're doing.
Right. Yeah. I was just thinking about that the other day. I mean, of course, I've thought about it in the past too, but how helpful that would be, and how I feel like it just should be mainstream that you should have a checkup at least once a year with your physical therapist. I mean, like we check up with our teeth to make sure they're functioning well. Why don't we check in to make sure our whole muscular system is working well? It's so much of what we do. So one day I have confidence that it's going to be a thing, or at least some people are going to start doing that and make it an important part of their life.
Becoming a little bit more kind of part of our practice. I know at least for mine it is. I have some people that just kind of check in with me on an annual basis or semi-annual or whatever before things totally derail, and it's really helpful so that we don't have to be only coming to us for PT when we are in pain or discomfort and things like that. The prophylactic approach is always beneficial.
Yes. Awesome. Anything else? Any other questions or myths, or I'm trying to think.
Things that I often want people to know that I feel like they don't know. I will say, oh, one other, a good reference if you want to learn more about this or just enjoy reading books on the topic. A really great resource is a book by Katie Bowman. I'm actually in the process of rereading it again. I was able to get it out of my library, so you
There you
guys
go.
might be able to too. But Diastasis Recti, and it's the whole body solution to abdominal weakness and separation. So she's a biomechanic, and she has done a lot of research in this area and gathering information, and she just is able to really explain in a way that anybody can understand it, but she doesn't dumb it down either, which I appreciate. And she goes through a lot of different points about, for example, kind of the anatomy of the diastasis and our kind of midsection. She goes over to about how to kind of check in with your body and understand what different postures are, that neutral alignment I was talking about. She also kind of adds in some exercises and things that are appropriate to try and incorporate into your movement and things to help support a diet, or even to kind of prophylactically help support the system if you're curious about wanting to try to kind of do some work on the front end to maybe help decrease your risk of this happening.
Yeah.
As well as if you already have it, to give you some tools too, more specifically, that you can start to incorporate into your activities to moving better. It's a really good resource that I would recommend people check out.
Awesome. Yeah, that's great.
Yeah.
And I think we'll drop the link again to what we did last time too for finding a women's health specialist. So if you're listening to this and you're thinking, yeah, I do think that I need to be seen, there's actually a whole directory she talked about last time, but we'll drop it here too. So if you need help finding, a physical therapist that specializes in this, because not all physical therapists specialize in this, then you can do so.
Yeah, so there is an online directory that you can find online. The website is pelvicguru.com. And it is an online directory that is global, that has a bunch of different pelvic health professionals that are all on there, from exercise coaches and personal trainers that specialize in pelvic health education and things, as well as physical therapists, occupational therapists, physicians, psychologists, all kinds of things across all of these topics. So it's a really great resource that has just been released, and providers are continuously adding themselves to it. So if you go on there and you can't find somebody specifically close to you, keep kind of checking back, because this directory just got released this past month. So it's new and constantly having new providers added. So don't be discouraged. And if you find that you don't have somebody near you after you check that list, feel free to reach out to me personally, because I can reach out to my contacts, or I may know somebody near you that just may not be showing up on the directory, as well as offering even kind of a virtual consult, and that can be an option too. So feel free to that's available for you as well.
Awesome. Yeah. Yes. Awesome. Thank you. Super helpful. Anyone that's on right now have any questions, comments, anything you're dealing with or want us to answer while we're on live? If you're watching this replay too, you can comment too, but just for anyone that's on live right now. All right. Well, if we don't have anything, yeah, that's good. Means you covered it well. So.
Through a couple of different renditions, but I think hopefully we got some good information out there for people to feel more informed.
Yeah. Awesome. Well, great. Well, thanks for hopping on again. And I know I asked you last time, but where can my followers find you and reach out to you?
On Facebook, you can find me at Pieton Physical Therapy. Pieton is my last name. And I'll drop some of this information in one of the comments too. And then on Instagram, I'm Pieton PT. And then those are probably the best two places to sort of get a hold of me. And I'll include my website too that has all my contact information if you want to reach out via email or anything like that. So
Yeah, awesome. Well, great. Yeah, no, she'll answer your questions. She's great. And thank you, Veronica. She said great info, but thank you for being on. She was on with this is our third try. We're having some echoing problems, and she helped let us know when it was finally not echoing. So thank you for being on. But
yeah,
awesome.
absolutely.
All right. Well, thank you so much again. And if anyone thinks of any other questions, specifically women's health related, pelvic health related, again, it doesn't have to just be specific to women. Let us know and we can come on again for a live stream. I know the two topics we've covered are the most common questions we get, but if there's anything else you think of that would be helpful, let us know. So, all right. Well, thank you so much. And I hope you have a good Saturday. And thank you for everyone that jumped on. All right. We'll catch you all later. Thank you, guys. Bye.